Very good evening, one and all. And I, Aarti Singh, welcome you all in ISFCP dialogue series. And today we have with us our speaker, Dr. Ebenezer Ajayi, who is currently working as a senior lecturer and acting head in the Department of Biochemistry, Osun State University, Osogbo, Nigeria. He is currently he's a biochemist having 19 years of experience in clinical biochemistry, mitochondrial membranology, molecular biotechnology, medical genetics, mitochondrial isolation, microscopy, DNA extraction, and many more. And today he will deliver his talk on neurocardiogenic syncope, which is a worrisome killer. So, we welcome you, sir.
Okay, thank you, Dr. Harty. It's a pleasure to be here to deliver this short dialogue, a time for discussion on this beautiful topic. I am grateful for inviting me. I'm grateful to the ISF College of Pharmacy, Moga. Thank you for this privilege. Um, Straight to the point, I want to speak on neurocardiogenic syncope as a worrisome killer. I picked interest in this topic because of my own personal experiences. I say experiences, I will let you know why it's experiences and not just one experience with this worrisome killer. And in that light, I want to proceed in this format just to introduce. Since it's going to be a dialogue session, I hope that with my short talk, we'll be able to now discuss together, exchanging ideas on our expertise because I won't say I'm an expert, as it were, beyond the laboratory inquisitiveness that I have been curious about what I experienced around this topic. All right, so as a matter of introduction, neurocardiogenic syncope itself, sometimes people call it vasovagal neurocardiogenic syncope. There are several names for it. It may not necessarily be neurocardiogenic, but just syncope or something that goes along with the heart and sometimes with the brain. So there are various names to describe this condition. So it's a sudden drop in heart rate and in the blood pressure, and this would lead to fainting or slumping. So it's usually a reaction to some stress. There must be a trigger, maybe a stress, maybe from fear, it may be something from flight, maybe something from freeze, because we will recall that those are the three uh, categories of responses that we can give to a living thing can give to threat. So you may end up freezing, not knowing what to do in response to that or reaction to that threat. It may be because of fear, and we are not able to run, or we don't know what to do. And sometimes we are able to run away from it. So some anxiety builds up, and sometimes it leads to this syncope. Okay, so I have this experience. Maybe many of us we have that experience growing up, that we find school children who find it very easy to faint, especially when they are responding to being punished and for fear of being beaten up by their teachers, for example, as a matter of punishment, then they just go on to faint. Those days back then, I would wish that I could be able to do that, but I couldn't. But later on, I realized that it's something that is not faked for many of them. Some people are not able to face their fears and then they cease from breathing. They may have hyperventilation because of the reaction, the capacity of the blood vessels to pump, the heart to pump blood through the blood vessels. And if they're not able to accommodate it, then it goes to shortage of oxygen to the brain, and sometimes can be so grave to cause ischemia, hyperfusion to the brain. So this short supply leads to fainting spell. So let's see the characteristics and then the classification. This condition we are describing is generally characterized by transient loss of consciousness, however short it may be. Very, very transient, and is accompanied by falling. Usually, if the person was standing before, it drops down and falls. The falling may be different, either falling forward or just falling on the single spot to sit, or sometimes may fall back. Sometimes it may depend on the age of the patient who is experiencing it. So there are old people that have this fear of falling normally as they age, as we grow up. So some of them are not able to withstand such shortage of supply of glucose to the brain and supply of oxygen. And then sometimes it comes with spontaneous recovery. Either someone is nearby or not, they just get up after a little bit of time when blood flow to the brain is restored. So I find in my experience also that you ask such people or you try to help them to raise their legs. So if they feel dizzy just before the falling or the loss of consciousness, you help them raise their legs so that blood can flow to the brain. So usually for people who do long-standing jobs, blood flow from the legs upward may be affected, and then it can lead to this loss of consciousness. So quickly, with the categorization of this condition, usually is into four categories, four headings. Can be reflex mediated, trying to respond or run away from a particular trigger, it can cause it. Or it can be cardiac, maybe because maybe some exercise that was happening or something rigorous can lay a lot of load on the heart, and then the heart may not be able to respond. It can be orthostatic. The person may not be really doing any particular thing as it were, but for whatever reasons, blood supply or glucose supply or oxygen supply to the brain may be abated. And then cerebrovascular, relating to how the vessels pump the blood to the brain for whatever reasons. Some people have it as idiopathic. No underlying cause is maybe detected. And some people they kind of are born with it. Okay, so let's move on. Quickly, the symptoms that people have reported or have seen when such things happen include nausea or vomiting. So they are restless or they feel light, close to lightheadedness, nausea, they feel discomfort, and then the stomach may rumble, may not really give them freedom to feel as if they are in control of themselves. Some may have sweaty palms because they are very, very afraid to explain what is happening or to face a situation. And I've seen students in my university, my department, a particular student actually, whenever she has a presentation, she wants to speak and then she keeps gasping for breath and she won't be able to go on. All of a sudden, you begin to see her breaking sweat. Then lightheadedness, they just get disconnected. Sometimes it may come with some sound in the air, some noisy sound like a buzzer alarm, and then the next thing is they like switching off, and that is blacking out. And then again, there can be change in vision, can be blurry, cannot really see from far. They are trying to stay awake, but they will not be able to stay awake, such as seeing spots or having some tunnel vision. And then there can be headache as well. To the evaluation and testing, to evaluate this syncope, it begins with a careful history. There must be something to relate it to, something to say it as it happened before. Okay, so there must be an history. How many times? What happened? What situations surround the occurrence of this fainting spell? And then there will be physical examination as per checking a lot of things, the heartbeat, checking the blood glucose level, checking the PCV, how much blood cells are there, and some other background check. The blood pressure can also be monitored, and then you ask if the patient feels certain pain or stress or ache around the chest. All of those things can be seen as background checking, physical examination, and then the electrocardiography to be able to monitor the heart function. How does it beat? Is there anything like humming sound, like sinusitis, electrocardiogram, sinusitis, and the likes? And sometimes when needed, usually according to the age, if the person is elderly or an adult, a youth, thereabout, a further evaluation may be needed, and this may include prolonged electrocardiographic monitoring. So from time to time, periodically, and then there may be need for echocardiography, listening to the heart, all the events going on. And then when there are triggers and responses, you want to know how does the heart respond. Some people at any news, or depending on what kind of news they may receive, they jack, and some people they just sigh periodically. So you want to check how does the heart respond to triggers, and then you can do some exercise testing, trying to put some load on the heart to see how the person can bear it, or how far they can go under such vigorous or depending on what grade of exercise they are asked to do. It may be walking. Some people cannot do brisk walking, for example. They the gas for breath, not to talk of now jogging, not to talk of now running. And then there can be further testing, more like MRI scan, the head computed tomography, check the carotid and transcranial ultrasonography. Maybe a need to even do the EEG, that is the electroencephalography. This can help us to dictate the general practitioner, the doctor, to dictate further things around the cardiovascular performance and to know the causation of the syncope. All right. So now, being a dialogue, I want to go to personal experiences. I know personally, growing up, I used to have pain in my chest, and I remember my mom would took me to see the doctor, and then the doctor asked several questions. Did I fall? Do I play rough? And things like that. Why did I have pain in my chest? There was an occasion that I was washing my clothes and I bent over to wash. Just to rise and change position, I could not rise. I felt like something was a clamp hooking my rib cage. I was unable to stand up. It lasted like 4 to 5 minutes. I was a secondary school student at that time, maybe year three. I had to control my breath and then until I felt a release and I was able to get up. So the pain would come and go. But then I was a turnaround around 2012. Around 2012, uh, I started taekwondo in 2010. I started taekwondo in 2010, and doing warming ups, I realized yes, we have to jog and run the stadium. But I realized that my heart could not really take that. I feel shortness of breath so easily. So I will report to my coach and he will say, okay, just take it slowly. If other people are going 10 laps, you go 5 laps around the big expansive stadium. But on one particular occasion, I jogged. I know the heart would try to accommodate the blood flow to carry on with the jogging and the vigorous exercise. So I was pressed. I wanted to relieve myself, to ease myself. So I stopped to ease myself. As I was standing there to urinate, that was the last thing I knew. And I can't really say how long I was there, lying on the floor. The moment I opened my eyes, I saw myself on the floor. So I cleaned up and then walking towards the rest of the practitioners of Taekwondo at the stadium. They started calling me, where have you been? Come over, let's start. So I joined them and I was able to do all the vigorous things like kicking and jumping till the end of the session. What happened? I will still come to that. Another episode, which is like episode 2, as a staff of my university, we have this academic football club, and I will be the goalkeeper, like the second goalkeeper, and sometimes I play the back quarterback. And we had to jog. My experience every time until recently would be whenever I jog. So when I feel dizzy, I take time out. But this time when it would happen, I wouldn't feel dizzy. So there was no warning. I would wait to urinate and then boom, I fall. So later I realized that okay, the pressure that dropped, now the heart has been overlaid with a challenge, a stress of jogging, and I had to breathe. My heart had to pump lots of blood. Then when I stopped to urinate, it's a prayer drop. The sudden drop in prayer from the release of urine made it so easy for me to collapse. So that happened on the field. And when I got up, they were shouting, goalkeeper, where have you been? Come over, we want to start. So I usually think that it would last like 1 to 2 minutes. So if in these cases nobody was there to see, so nobody could really explain to me what went on. Until the last SP episode, nobody has been there to see. At other times, when I train outside the country for Taekwondo and I feel dizzy, easily I raise my legs up, okay, and then I get fine again. I continue. So I thought if I could push myself a little further, I could gain that agility to do to fight in the ring, do 3 rounds to 2 minutes each. And funny enough, whenever I'm in the ring and fighting, I do not experience such a thing. All right. The episode 3 also happened on a stadium when I was running. But the last one that happened early July, the first Saturday of July, I was meant to go to the stadium for taekwondo training, just like I did this morning. I just came back a few minutes ago. but then I felt dizzy. I didn't feel dizzy immediately. There was rain, and I got up, I think, too suddenly from the bed. I went to the bathroom to wash up, and then I had this sound in my ear, and I felt lightheaded. So the last intention I had was to find my way back to the room and get on the bed to rest, and that was it. The narration that came, thankfully, my wife uh, he was there, and that was the first time someone was there to see what happened. So I fell backward, hit my back on the door, and that was the sign that woke my wife. And then I sat down like that, went down and sat. And then she observed that I was there, eyes open, and then jacking, making some jacking movement. Okay. And after some time pouring water on me, I came back and I was like, what happened? Okay. So all of these things happened, but the most recent one is just one I narrated. So for the first time in all these experiences, I went to the hospital to check. And the doctor asked, okay, before then, they checked the blood glucose level, it was fine. Checked the blood pressure, it was fine, 100 over 60. I've never had any record of high blood pressure. And then the doctor was asking, then what could it be? So they did some other check and then go ahead and do the platelet, the PCV, the full blood count, check if there was anemia, and check the ECG. The results came more or less fine, except for certain things that the result for ECG showed. I've not been able to go back. I just got the test result recently. I have to go back this week. So when I was approached to pick a topic to discuss as a dialogue, I felt, okay, fine. I think this is the most pressing condition or situation that I am passing through. And I'm not the only one. In Nigeria, for example, and similar to other countries, there have been cases. In Nigeria, we see it among politicians who go around campaigning around the state, and from distress, while they are talking, holding the microphone, they just slump. Some of them recover, some of them don't. We have seen lecturers who have too much load of work, and I'm glad this is an academic exercise, a series in the ISF College of Pharmacy. We have lecturers who will go from meetings to meetings, mark lots of scripts, attend this, attend that, write manuscripts back to back like that. And they will be teaching and then they slump in front of the class, and then some of them don't recover. My experience with some lecturers is being that some lecturer has fallen. I think one of them died in one of the universities around us here. The lecturer slumped, got to the hospital, and was declared dead. So there are some that slump, and when they get up, they may be paralyzed. So in my own case, not once, not twice, not thrice, I've been lucky, but who knows what has happened. So we have to check the condition of our heart. So I go to the concluding thoughts and remarks. We have to be very, very conversant with how functional our heart is. How functional is, that will be the next slide. How functional is the supply to the brain? Many times, especially when we begin to cross age 40, all the normal checkups, we should not skip them. We should not just assume that we are fine. I eat well, maybe I'm a vegetarian. I don't eat meat. I do not have any issue like around fatty liver. I don't have issue with organs clogged with fat. I'm not obese. People ask me, but you're a sports person. I say, yes. So why would this happen to you? So I listed a few things, like three headings here. What programs do we do? For me, I developed a program luckily during the COVID lockdown, which is called Slow Body Movement for Wellness and Longevity. That is longevity now, because it's a journey that should begin maybe more like yesterday. But whatever stage we have for our health, we can begin now so that we can begin to become rejuvenated. Doing slow body movement. It doesn't have to be vigorous like jacking, like taekwondo. I also practice a soft one called Tai Chi, which are slow like a dance. For all of these things, they are very light load or challenge to the heart, giving the heart enough opportunity to respond and get accommodated and adapt. It's like adaptogenic. And more like what we discuss in omethins, we don't say that they are drugs. They are things that challenge the body cells, allowing the body to adjust so that they can overcome the challenge, and the body in that process will be able to heal itself. So it might be mild, can be heat therapy, can be cold therapy, can be heat shock, either for cold or for hotness, can be mild exercise as easy as walking or brisk walking, whichever one our body can accommodate. So we don't always have to be the Jackie Chan or the Bruce Lee, but at least do certain things within the little space you may have, however small it may be, that can become a lifestyle. And beyond the lifestyle changes, we say beyond what we eat, we are what we absorb. Some of us may have to change our diet. We have to change some habits, including heavy drinking or smoking or abuse of drugs. And again, we have to maximize rest because we have stress from the kind of thing we do. So we talk about free radicals, oxidative damage, and all of those things. So we have to accommodate that. Yes, there is stress. For every effort we make working, if you do it too much, it can cause stress. We are not saying we should not do, but at least let us watch all of these things and how our body responds. Don't let us overdrive ourselves. So sometimes can have brain stress, and then we can hyperventilate. We may not have enough rest. So all of these things are very, very important. And then that leads me to the lifespan consideration. If you go back to our basic integrated science, we say the characteristics of living things. Some of them we also say Mr. Niger D, some later we say Mr. Niger Cal. So for every movement we make, for every respiration we do, there are things that build up, which can be free radicals. For the nutrition we eat, there may be toxins. In the detoxification process, there can be load on our organs that are involved. And in the irritability, how do we respond to triggers and stress, like you said? Is it for flight? Is it for fight? Is it for freeze? Okay. And then sometimes some of us, we suffer from recall of memory. And when we remember certain things that made us react in such a way that is not so very tolerant, and something near that is happening psychologically, we may enter into that phase again. Okay, and then for growth, as we grow, and then there is excretion, which may be thorough, may not be thorough, depending on what we expose ourselves to, or the kind of enzymes, for example, the CYP450 that we produce, we may suffer for it. And then there can be cross reaction between our food and drug and nutrients, okay, that can cause all of these things that make us react. And then for reproduction. So when we say D, after we reproduce, unlike some living things, they may die. For example, plantain dies immediately, produces the fruit. But humans and several other living things don't die. Death doesn't come immediately. So we compete, we adapt over our lifespan. So during that competition, how do we manage stress? How do we unwind? How do we relax? Do we really find time? Some will say they are unwinding, whereas they are loading their body with more damage. Unwinding over heavy drinking and resting and relaxing over cigarette smoke and some other harmful habits. So we have a lifespan. Now, the consideration is, do we want to shorten it, or do we want to expand it, or do we want to maintain it? On this note, I want to stop. Everyone present, please feel free to contribute to things that is very real. It's a silent killer. And many people will say, we still did this together yesterday. He was at the class yesterday. He was at the meeting yesterday. How could it be that such a thing happened to me? He looks so healthy. I'm shocked to hear that he has just passed on. I pray that will not be our experience, but please let's do regular checkup and pay attention to our body. Our body speaks. Thank you very much. Namaste.
Thank you very much, Dr. Ajay, for sharing your valuable experience. We really appreciate that, and thank you very much for accepting our invitation. So, thank you very much, sir. Thank you very much. It is really very valuable. Thank you.
Thank you very much. Kubdaya.
Yeah.